when we looked at posture, and I think this was quite interesting amongst the professions. So physios and osteopaths were quite similar in terms of whether or not they thought grading would be useful. Okay, in terms of, you look at somebody and they're very kyphotic, very lordotic, and you kind of, right, okay, in terms of those, aspects, right, I can maybe get a number for those. Okay. Osteopaths, physios, around about 25% of osteos and physios thought that was going to be useful. Interestingly, almost 49% of the chiropractors thought that it would be useful. So again, there's a little bit of a difference in terms of how we're utilizing postural assessment and what we might want to do with it. And I think, there are studies out there that have looked at grading of posture. So there's a German researcher called Ludwig who's looked at posture and come up with, he's looked at it over the past sort of 10, 15 years, looked at an adolescent population. He has done a grading scale based on postural assessment, and he's updated that across kind of a bigger sample more recently in 2023. And it's interesting, not the majority of clinicians don't think that that's going to be useful. However, if we get a better way of measuring this, then, maybe clinicians will buy in a little bit more. And I think some of the things that have hindered, people's kind of thoughts on posture and their ability to use postural assessment as a modality are things like ease of use. So if it's a visual assessment, then it's very simple, very quick. You can do it straight away. But as soon as you have to get a kind of angle measure out, or you kind of have to take a photo of them, you kind of like, you're talking 10 minutes of your time or 20 minutes of your time. You're like, I ain't doing that for my patients. That's ridiculous. Whereas actually, if we could come up with a method that is very quick and easy, that is reliable, measures, is relatively low cost, these are all things that the clinicians said could be useful in terms of objective posture, then actually we might see a bit of a shift towards clinicians utilizing a more objective way of assessing posture.